My name is Dr. Shahzad Ahmad. I'm a thyroid specialist. My background is in endocrinology, but my practice revolves around treating thyroid conditions, including thyroid cancer, parathyroid disease, and most recently, for the last 1 year, thyroid interventions, including radiofrequency ablation. Our center has been extremely successful at bringing this technology to the US. We have treated dozens of patients successfully without any complications, and we're very excited to be able to help our patients avoid thyroid surgery that used to be the only option for treatment of various thyroid conditions. Majority of thyroid surgeries that are carried out in the US are done for benign disease because patients are bothered by the size of the thyroid nodules, their cosmetic effect because the neck is a sensitive area, and sometimes there's difficulty in swallowing. Some people will have voice changes and cough and a general feeling of tightness in their neck, and the only option used to be to surgically remove the thyroid gland, which left the patients vulnerable to certain complications that can happen even in the best hands in surgery, and would also lead to lifelong thyroid hormone replacement. With RFA, we can offer them an alternative which is safer. There is no doubt about that, because the side effects listed and noted when RF procedures are performed, or radiofrequency ablation procedures are performed on thyroid nodules, suggest that it has got a very favorable side effect profile, much safer than what surgery does. Obviously, in certain situations, surgery is necessary, but having an alternative like radiofrequency ablation is really important, because this alternative non-surgical option has been available in the rest of the developed world for almost 15 years, if not longer, and I'm really glad that our patients can now also avail this new cutting-edge technology. Parathyroid problems are fairly common. They lead to significant morbidity in a lot of patients. Typically, the best treatment option and the standard of care has been surgical resection of parathyroid tumors. However, not all patients are eager to go through surgery, and some patients are not very good surgical candidates. We were aware of data from Korea, Italy, and Germany that parathyroid tumors that are usually benign have been treated successfully using radiofrequency ablation, and I believe that it is worth exploring this option in the US. Treated over 24 patients almost now, and we've had 0 complications. It's been really good, other than some mild discomfort that happens after the procedure, which has been self-limiting. But in terms of any serious complications, anything permanent, anything persistent, we have luckily not encountered anything. We've been very diligent at monitoring our patients for the possible side effects, and so far the results have been exceptional in terms of size reduction of the nodules, absence of side effects, absence of thyroid dysfunction. In fact, in patients who have hyperthyroidism or toxic nodules, we've been able to normalize their thyroid levels in almost all instances within 4 to 6 weeks after the procedure, which is excellent when you compare it to what typically happens with the traditional treatments of radioactive iodine. So we're very excited about those results. Every patient who is contemplating thyroid surgery for benign thyroid disease should at least have this discussion with somebody who knows how to perform radiofrequency ablation. It is worthwhile to know all your options before you proceed to surgery, which is kind of irreversible. Once your thyroid gland is out, obviously it cannot be put back in. So it's a difficult decision. It should not be made lightly, and all options should be available to the patients before such a decision is made.